Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches, and today is Friday, May 22nd. I'm here again today with Ed Brubaker, our President and CEO, for another one of our weekly roundups, I guess we are saying now. Let's start with something a little bit more lighthearted this time. I hear that you, of course, as am I, are an Eagles fan. So I hear this week we have an opportunity to make fun of those Steelers.
Yes, we do. Yeah, somebody was saying that Ben Roethlisberger got in trouble with Governor Wolf because he filmed himself getting a haircut and his beard trimmed at a barbershop, I guess, in the Pittsburgh area or something like that. So I don't want to get in trouble with Governor Wolf, so my hair is still growing. It is getting to be a bit of a pain, but I was threatening to maybe cut it over the weekend myself. So we'll see what happens. But yeah, it's one of those things that we're kind of all in this together. And I think maybe part of it is when we see someone in a position of power or authority. I know the mayor of Chicago caught some grief a few weeks ago for getting her hair done as well. And when we see sports figures or whoever, people that are looked up to, we tend to call them out if they're doing something that doesn't seem like it's in keeping with what we're supposed to be doing. So that was kind of humorous. I'm sure none of the Eagles would be doing that kind of thing. So it's just those doggone Steelers,
of course,
on the other side of the state.
Did you, was it last week? I believe that I had a corrections corner that I had to make. Would you like to make a correction corner for this week?
I don't know if I'd say a corrections corner, but just some additional information. I know I talked about the video that we played at the end and the beautiful song that Jen and Sophia Locker had sung, but there were also some other people in that video and the musicians, and in fact, they were amazing because some of them played two instruments on the video at the same, well, maybe not at the same time, but they were both recorded. So Rich Moore was playing two different guitars on the video. Mark Abissi was on guitar and keyboards, and Gary Weeder was playing the drums. So I did want to recognize them as well, in addition to Jen and Sophia. I thought they all did such a great job.
I heard a lot of positive comments about that song, so I'm glad we could recognize them.
So if anyone didn't hear it last week, just skip to the end of the video from last week and you'll see a lovely song about trust and giving our cares to God during this time.
Very timely. Well, let's take a moment and update where we are with our coronavirus testing at Living Branches. We continue to have no residents or staff persons at the Willows of Living Branches testing positive. At Souderton Mennonite Homes right now, we have one staff person who has tested positive and is still out on quarantine time. And we'll talk a little bit more about other testing at Souderton in just a minute. And then at Dock Woods, the only place that we have active coronavirus cases right now is in Dock Terrace, which is our skilled nursing area. And we did do additional testing this week, and we had 3 more residents test positive and 11 test negative within that same testing. So we were pleased with that. I was reflecting to someone today that it seems like we're seeing with our coronavirus tests that almost, at least the residents in Terrace who've tested positive, have almost a bell curve. So there are a group of them that have basically no symptoms, a few who have no symptoms, a few who have pretty severe symptoms, and then a much higher group in the middle who have maybe 1 or 2 symptoms in the beginning and now are maybe getting better. So we're talking in our meetings now, our coronavirus response teams meetings, about the fact that it may be time next week to look at retesting some of the residents in Terrace and in Country Cottage who initially tested positive and then were asymptomatic or had one symptom and now are resolving. So that's great news.
Yeah, it is very good news. And we want to do that as part of our testing strategy, like we did at Harmony House, where you had a negative test. We got a negative test for all the residents, and then the second negative before we could say that we feel that, not that it's over, but it's more under control as far as that is concerned.
And then this week's really exciting news, knock on wood, with testing is at Satterton Mennonite Homes in Healthcare. And there we tested all residents out of an abundance of caution and just a desire for knowledge. And I'll let you share the results.
Yeah, and we actually don't have all the results back because there were 2 tests that they will either need to redo them or rerun them. We're not entirely sure yet. But 64 of the 66 came back negative, and so that is really very positive news. The challenge is that was then, and what happens next week or the following week, we don't know. So we want to celebrate that and say that's very good news. But the other thing we know is that we do things fairly standard across Living Branches. So what might have been the thing that happened at Dock Terrace? We talked about this probably 2 weeks ago. What happened at Satterton? And so we're not fully knowledgeable about why all that is, because we do common things with HVAC, with cleaning protocols, that kind of thing. Having said that, though, we are very happy and very pleased that was the case at Satterton, and we'll take that good news.
Absolutely.
It's very good news.
And before everyone who's a family member in Satterton Healthcare emails me, this does not mean we're starting visitation. Unfortunately, our campuses still are, all of us in Montgomery County, we're still under red orders, which means no visitation in nursing homes. But
yeah, that's correct. And I think even in the yellow, there's no visitation in nursing homes. And this is really hard and very difficult. The challenge is what's going to be that thing that, or I shouldn't say thing, but that person that may bring it in. Is it a visitor? Is it a staff member? Is it someone else? And so this is something we're talking about at Coronavirus Response Team and need to be developing a plan over time. And we recognize that we need to have something put together to have some way to visit. But we do know that visiting is not going to look anything like it did in February anytime soon.
So we'll be making announcements about that as things change. The big news, I guess, this week all across the state is that the state has released what they would call their comprehensive report on nursing homes and assisted living facilities and personal care homes within the state of Pennsylvania and how many COVID cases they have. I have to laugh at that because 2 of our personal care communities aren't even on that list. So it makes me question their data. But it's been all over the news. So would you like to talk about that?
Sure, and that is a challenge. And I would say too, not that I'm looking to defend the state here, on the other hand, the amount of data that was being collected was huge. And so my feeling is they probably rolled it out a little too quickly and didn't think through making sure and maybe responded to pressure. I don't know what all happened. But the point is there were some inaccuracies even in some of our data, not as major with us as some other places. One of the challenges is and one of, frankly, the frustrations for us, and we've talked with our legislators, and I'm not sure that anything will be able to change, but there are so many places, literally, that we're inputting the same data to the federal government, to the state government, to the county government, to the local municipality. Overlap all over the place. It's really, really frustrating. So we don't quite know where they got their data in the first place, but we do know we were just added another place that we need to input data on a daily basis last week from the state, saying we needed to start last Saturday, and we got the information at Satterton after 5 o'clock on Friday night. I'm not quite sure if they realize that we're doing other things other than just collecting data, but let me tell you, we are. And that really is disheartening, to be perfectly blunt about it, and I really hope that can change. For the future, I'm not convinced it's going to change much during this pandemic. But having said that, yes, they did go through that process. For us, part of me kind of says, well, bring it on, because our data has been out on our website for weeks and weeks. We have not looked to hide any of our data. Sometimes, as we admitted in a video the other week, we made an error. That wasn't something on the website, but an error in what we said in the video. And so we really believe strongly that we need to be transparent. I've said this multiple times on these videos. So we want to make sure that we are transparent in what we do. So we've been that way. And so the fact that it's now on the front page of the Enquirer, I would say hurts a little bit, because there it is in black and white for everyone to see, not just those looking at our website. But at the end of the day, it is what it is. I think the other thing to say too is that it's easy then to start looking at the number of deaths and the number of COVID positive and start making judgment calls about those facilities. And I would say, and my challenge to all of us, myself included, or all of the viewers, is to say, you really need to get more information before you can make a judgment call as to whether that is a good facility or a bad one. I can tell you this, both Doc Terrace and Saturday Night Homes are 5-star rated facilities, staffing and everything else. And so you go on the governmental websites, we staff heavier than most facilities, excellent places. Our staff works hard. One place we had it and one place we didn't. I'm sure there are reasons, if we could ever figure them out, as to what might have contributed to that, but it's very difficult. And so you really can't say one is a higher quality than another facility. But having said that, it is what it is. It's now out there. Unfortunately, it wasn't all correct data, but we'll deal with it. But it's not going to change how we behave, meaning we were transparent before, we will be transparent in the future, because really we believe that's the right thing to do. That's the best way to build trust, is to be transparent and straightforward with the data.
And maybe we should just point out too that as these weeks go by, presumably they're going to keep releasing this and updating this information. So if there are times when what's being reported at the state level disagrees with what's being reported on our website, I would feel pretty confident saying our website is more accurate.
Yeah, that's right, because we even know that I think it was Doc Terrace, I believe at that moment in time, the numbers were correct for residents, but I think it had 0 or an asterisk or something for number of staff positives, and that's not correct. Mm-hmm. But go to our website and it is correct. Yeah.
Another question, this isn't really a question, but I've had a couple people this week making different comments, really talking about what are we learning about COVID? We've talked about the fact that it's a challenge because this is a brand new disease. And so we don't know a lot about it. No one knows a lot about it. And people are wondering, what are we trying to do to learn, to talk to experts? Like, who are we reaching out to, and who's assisting us in this journey?
Yeah, no, that's a good question, a good point. And the reality is there are some experts, I think, but even the experts are learning. I mean, there's new symptoms. Over the last 3 months, stomach issues or other things related to that were not part of it. If you recall, at one point they said the lack of the sense of taste became a symptom. So there's things like that that are changing all the time. And frankly, when you think about it, when it's something you've never seen before, you're gonna learn things along the way. So that's the reality of this. But we are trying to get as much information we can. A few weeks ago, there was an article about a facility. This was actually very early on, and Dr. Josh Wee, who was the medical director, and saw it in the Enquirer, said to our medical director, Dr. Dan Hamowitz, hey, do you know this person? We had a phone conversation with him to try to learn from him. And they had some experiences early on, and so we learned some things from him. We spoke with the medical director at Canterbury in Richmond, Virginia, who had a large outbreak at the early stage. And so we had a conversation with him as well. And all these people are very willing to speak to you. I mean, we want to learn together. We've been reaching out to the county Department of Health, or I guess they call it the Office of Health now, or something like that. And so we, through Murray Sheeran, our infection control preventionist, have been reaching out to them regularly. We just had a phone call a week ago with them. Unfortunately, they couldn't give us a lot of new information about testing that's also coming out in the news. But together, hopefully we can work at some things. But we do find that we need to forge forward and come up with our own plan, because it's certainly not being given to us as a template that here, just follow this X, Y, and Z. The other thing too, more recently, and this hasn't happened yet, but the CDC had given some people to the state of Pennsylvania, Department of Health, and we're going to avail ourselves of a visit with them. And what I'm most enthused about is, number one, they were originally just going to come to Souderton for whatever reason they were on their pick list, but they're willing to come to Dock Woods, and we want them to come to both campuses, and we want them to see what's going on. I want to know, are you seeing any differences? We'd like to think we're similar, but what are things you're seeing? The outside party. The other nice thing is they said they'll actually go onto the unit, and my ears perked up with that, because unfortunately a number of other persons from other regulatory bodies, et cetera, have tended to come in, sit in a room, look at our policies and say, oh, that looks great. Well, that's one way to look at things, but you really need to eyeball things out on the floor. What's going on? Are people donning and doffing their masks and the PPE correctly? All that kind of thing. So I'm not sure exactly, we haven't set it up yet. So when that visit will take place, but hopefully in the next week or two. But those are things we're trying to do. We're reading articles, we're sharing best practices. I'm on phone calls all the time, as are other members of the CRT, just trying to understand more and how do we learn together, and because we certainly are into this together.
And then a question from a resident this week. Ethel wants to know, her family is making summer vacation plans. And what recommendations do you have for her as a resident?
Yeah, and part of that may determine like what level of care you live in. Mm-hmm. Residential living, some call it independent living, is different than personal care, which is different than health care. I think one of the biggest things is be smart. Hanging out on the boardwalk in Ocean City without proper physical distancing and without a mask, I wouldn't recommend it, to be perfectly honest with you. But if you're going to the beach, maybe you have your own beach home there or have rented it for the week, and you're going to appropriately distance yourself from others. You're with people that you know, maybe they've even been tested and you know that they're COVID negative. You know, there's things like that you can do. I personally would not recommend flying on an airplane, but there's people that do that all the time. But you need to make your choices there too, because we're even looking at that from a staff perspective. And frankly, staff at this point in time anyway, if they're going to go on a plane, that's going to have consequences when they return to work as well, as far as being out of work. So there's those kind of things we are looking at. But read what you think is safe, do the appropriate safety things. But frankly, there's no danger. I shouldn't say no danger, but the danger when you're outside, frankly, is less than inside, particularly if you have the appropriate physical distance.
Yep. Okay, great. So now we're going to do something a little bit different this week. We have an opportunity to do a giveaway to help support a local organization. And this is going to be a reward for residents for watching all of these videos and watching to the end.
Or others as well,
or
from
others
the
as
general
well.
public or staff members or whomever.
Yeah.
Yes.
So tell a little bit about what our idea is.
Well, MEGP, which is the Mennonite Historians of Eastern Pennsylvania, they have a wonderful facility in Harleysville, and they have a dinner and movies, I think they're calling it, a fundraiser a week from today, actually, May 29th. And so my wife and I, Lucy, are on their web list, their mailing list, email list, and so they have a fundraiser next week. So we worked it out with them that we could get some discounted tickets, 10 tickets that we wanted to give out just as a way to publicize their wonderful organization and their unique fundraising event. So if you don't win, you can still buy a ticket on their website, but it's just another way to partner with another conference-related ministry in Franconia Conference, and just kind of a fun way to celebrate May next week. So we are going to give away 10 tickets, and in a moment you'll tell them how they can win that. But again, if you don't win, feel free to go on their website, buy a ticket. It's a chicken dinner, full chicken dinner, and then you have access to another number of movies that you can watch online over the weekend, including movies by John Ruth and other people. So a great way to support a local organization.
Yeah. And this, it's worth pointing out that the dinner, it is a chicken dinner that you can go get, or they are bringing to the Dock Woods campus or the Satterton Mennonite Homes campus to pick up. So if you're watching this and you're my mother and you're living in Washington or in Michigan, it's not really going to help you to get that dinner. But the movies are a digital download, so those can be enjoyed by anyone. So I think we should make our audience respond to us by answering a question. So why don't we say that in order to win these tickets, what people will need to do is go on our website or email me at coronavirusquestions@livingbranches.org. We will pick 10 people at random, or we'll give away 10 tickets at random from the people who email in by Tuesday at midnight. And when you email, you can answer a question for us, and you can tell us which Steeler we were making fun of at the beginning of our video. Any spelling of his name will be fine.
That's right.
You do not have to know how to spell Burger.
Oh, you just gave it away, Alex.
If they're watching this far. But go ahead, email that, how many tickets you would need, 1 or 2, to coronavirusquestions@livingbranches.org by Tuesday midnight, and we will pick the winners Wednesday morning at random and send you back an email with more information. So I think that's a great way to support, like you said, a local organization and hopefully do something a little bit fun.
So best of luck to everyone as you're sending in your answer to the question of who was the Pittsburgh Steeler that we were making fun of at the beginning of the video.
And next week we'll have to figure out how to pick on an eagle, I guess.
No, maybe New York Giants next week.
That's much more likely.
Or Dallas Cowboys, actually. That would be perfect.
They're always doing something you can make fun of.
Yes.
All right. Well, thank you, Ed. Thank you all for watching, and we will see you again next week.